Hello everyone, my name is Elsa and I'm going to be going over the application of the end-of-life theory to a real-life experience. I developed a little case study per se of Anne. She is 68 years old. She was recently diagnosed with stage 4 lung cancer, and due to the nature of the illness, she has chosen to be DNR and has opted for comfort measures. She is mostly concerned about the pain that she will suffer once her illness advances with time, as well as the changes her body will undergo with the disease progression. She is also worried her family won't understand her decision of comfort measures as opposed to choosing to undergo chemotherapy or radiation for the cancer. According to the peaceful end of life theory, Anne's care is individualized and her experience is personal. As healthcare providers using the layout of the theory, first and foremost, we must ensure that Anne is not in pain, and this can be achieved through different methods. There are painkillers and narcotics. They should be administered to the degree of the pain that Anne is feeling, so her pain level should be assessed, and narcotics should be administered according to her pain level. She can also benefit from having a consult with a doctor who's a specialist in pain management. Another aspect of the theory is she should experience comfort. And this is very important because comfort isn't just physical. It is nice to be physically comfortable, to have a warm bath, to have a nice bed, a freshly made bed, but also it's important to be emotionally and spiritually comfortable. So this could be many things. For the patients, it could be listening to music, prayer. A lot of patients, they get cards made by their families and hanging them up and seeing the messages that their family sent them. It really helps them feel that comfort spiritually. So that's also very important interventions. The theory also mentions experiencing dignity and respect. All patients are worth dignity and respect, and although Anne is now DNR, it doesn't mean that her care is any less important or that she should be paid any less attention to. She is still an active participant of her care, and we should still advocate for her as healthcare providers. And the main thing as well for experiencing dignity and respect, as mentioned in our textbook, it says this can be easily achieved by being attentive to the patient's expressed needs, wishes, and preferences. And this can be as simple as, is there anything I can do for you? That's very important, to be empathetic as well. Another crucial component of the theory is the concept of being at peace, and this is very important. And the main avenue with being at peace is emotional support, and this can be assessed through asking if the patient is experiencing any anxiety and intervening with anti-anxiety medication. If there's any questions regarding the care or procedures, we wouldn't want the patient to be anxious. We wouldn't want Anne to experience any anxiety if she's going for a test. We want to fully educate so that there's no anxiety felt about any prospect, or if there's a new medication or if there's a new protocol. We want to educate. This is what it is. This is what it's for. We really want to give the layout so that the patient isn't anxious at all and that the patient is at peace, more importantly. And even through just little things like helping with ADLs. If the patient is weak, it could be very stressful to not be able to brush their teeth or set up their tray for their meal. It's something as simple as that, that can help them feel at peace, that they're being helped. And lastly, but more importantly, is the aspect of closeness to significant others. So this is a very difficult time. The peaceful end of life theory is for people who are terminally ill. So this is a very difficult time, facing mortality in that sense. So it's important to have the patient's family members close to them and involved with the patient. So encouraging the close friends and family to visit will really help the patients feel better, and would feel much better having her family there. If they have any questions, it's important to answer them so that they're also involved and that they know what's going on, so that they're not surprised or caught off guard um, with the progression of the illness. They would both benefit really greatly from being educated and being kept in the loop, and just being close to each other and encouraged to have the bond that they share be actively participated in.